Hello and welcome. Thank you for giving us the opportunity to present to you here today for the 2023 American Nursing Informatics Association National Conference. Today we will be discussing our hospital scanning reduction project for the Emergency Department Discharge Instructions page.
My name is Judy Martin. I'm a program manager for the System Clinical Informatics Department at Sharp Healthcare. I've worked at Sharp since 2010. My role encompasses oversight for mobile devices, telehealth, patient video education, remote observation, and more. Prior to starting my career in healthcare, I worked for over 20 years in corporate sales and marketing, advertising, and public relations. I started my nursing career as a new nurse graduate at Sharp Coronado Hospital, where I worked for 6 years in the perioperative and ambulatory care unit. I've also worked as the clinical informatics specialist at Sharp Memorial Hospital for over 5 years. And I was excited to be able to work on the eCapture project with Judy Cummings and Carrie Yu.
Hello, my name is Carrie Yu. I currently oversee the point of care and post-discharge scanning for the hospitals as the document imaging manager. I've been on the hospital paper scanning reductions journey with Judy C. and Judy M. for over 2 years now. It is my strong desire to continue with this journey on getting as many forms as possible completed electronically. This will meet our organization Always Green initiative in reducing our carbon footprint. Thank you for having us.
Hello, I'm Judy Cummings, a black belt with Sharp Healthcare's Six Sigma team in our Office of Transformation. I have a deep background in information technology, specializing in software management, implementation, and workflow design in healthcare. Continuous performance improvement is in my DNA, and I love supporting the patient care team with enhanced patient documentation tools.
I'd like to start today's presentation with a reflection. If you can imagine it and you can visualize it, you can create it. Anonymous. Stay tuned at the end of this presentation for a Q&A session from the San Diego ANIA chapter meeting presentation given on February 8th, 2023. Sharp Healthcare is a not-for-profit regional integrated healthcare system located in San Diego, California. Sharp includes 4 acute care hospitals, 3 specialty hospitals, 3 affiliated medical groups, 24 outpatient clinics, 6 urgent care centers, and a health plan. Sharp currently has approximately 2,700 physicians and more than 19,000 employees. None of the presenters for this educational activity have relevant financial relationships with ineligible companies to disclose.
Do we really have an EMR? The amount of paper can be overwhelming. Here are some photos of the paper my team in HIM Document Imaging has already scanned. When the clinical teams create paper documentation, there's more to it than just scanning the pages. We must prep the pages to ensure the right patient, right account, legibility, and that everything is tapped down properly to feed through the scanner. We also do quality checks that are an important part of our process, checking again for the right patient, right account, and also if a page was missed during the scanning process. In addition to staff time for prepping, scanning, and quality checking, there is potential cost savings for the paper, printer toner, and labels that are placed on the pages to be scanned. Eliminating just one document can save as many as 200,000 pieces of paper that need to be scanned each year, and associate 5,000 hours of staff time.
At the beginning of a project, you need to know where you are so you can measure improvements later. We used 2 metrics at the beginning of our project analysis: number of pages and number of document types. The first metric is number of pages. This is the count of pieces of paper scanned. The second metric we tracked was the number of document types. since there can be multiple pages to one document. Take a surgical consent form, for example. It counts as one document type and 3 pages since each surgical consent form has 3 sides to scan. When sharing this volume data with different stakeholder groups, we set context and made comparisons to help people better understand the magnitude of paper. So with this graph, to put the baseline data in perspective, in fiscal year 21, the total amount of paper we scanned was 3.43 million pages. What does that mean? That's an average of over 9,000 pieces of paper per day that were scanned. Another way to look at it is 600 miles of paper when laid end to end. That's the round trip distance from San Diego to Las Vegas. Or, for the sports fans out there, it's almost 25 football fields scanned every day. Making these analogies help tell the story of how much paper was still used for clinical documentation.
The scope of this project encompassed the emergency departments at 4 acute care hospitals: Sharp Memorial Hospital, Sharp Chula Vista Hospital, Sharp Grossmont Hospital, and Sharp Coronado Hospital. By the end of this presentation, I will cover all of our learning objectives, such as outlining the steps used during this project so other organizations can implement a similar effort or replicate our scanning reduction project successfully and benefit from our lessons learned. I will also touch on some of the change management tools we used and discuss how we implemented education for our nursing staff, as well as our continual process improvements to sustain compliance. In outlining our project, we first needed to analyze all the paper forms in use throughout the organization and determine the best way to prioritize the ones to be digitized first. Then we assessed the resources needed both from a personnel perspective as well as technology needs. We opted for a pilot test at our smaller entity in order to validate some of our assumptions and be able to pivot quickly to make any changes required. We also needed a clear method to define, measure, and improve our adoption and compliance rates. Providing education that was both efficient and effective was also paramount to our success. Lastly, to assure our change was permanent, we needed to develop ongoing reporting and process improvements. While you're listening to this presentation, I hope you'll give some thought to how your organization can reduce paper. Which of our strategies would work best for the organization that you currently manage? This project is not just about listing the team members, but about teamwork. We say teamwork makes dream work, and it really did take a group from cross-functional teams to pull together the resources to make this project a success. Each individual had their own strengths, from analyzing the data to organizing and leading teams and managing the daily operational details. We were fortunate to have the expertise of Judy Cummings, our Lean Six Sigma Black Belt, to assist with this project. Her expertise was so valuable, and I will discuss in future slides how her skill set helped to guide and facilitate the success of this project. The 3 individuals that form the core team, Judy Cummings, Kara Yu, and myself, Judy Martin, have an incredible amount of synergy and complementary skill sets. Kara Yu works tirelessly to provide us with very detailed and accurate reports and to help keep us on track with our numbers and reporting, which is a crucial facet of this project. Judy Cummings is positive and diplomatic and was able to help us collaborate and pull together presentations for leadership and assure we had support along the way. I enjoy making order out of chaos and managing all the details of the daily operations, meeting agendas, and action items. And again, I can't say this enough, but having the support from leadership is truly the cornerstone of any successful implementation of this skill in an organization as large and diverse as Sharp Healthcare. And we continually focus on the 50,000-foot view, which is why we were doing this project, to reduce waste in the organization and save time, money, and trees.